So now I am showing you the section of the male pelvis. So in examination discussion, we are going to keep male pelvis and female pelvis, and we will ask you to identify all the structures from anterior to posterior. So before that, you have to justify this is a male pelvis and this is a female pelvis. As you see here, the most important point, so this is urinary bladder. Just below the urinary bladder, you can see a glandular structure, prostate. So this prostate is a characteristic feature of the male pelvis, and there is no uterus. And if you see here, so this is a female pelvis, you can see this is the urinary bladder, and below that there is no prostate, and just behind the urinary bladder you can see this is the uterus. Behind the uterus you can see the rectum. So this is uterus and this is the vagina. So because of presence of uterus, so this will be justified as the female pelvis. So this is the justification. So if examiner asks, so which is the male pelvis and why you say this as male pelvis, you say that here there is prostate gland just below the neck of the bladder, and this is the male pelvis, and there is no uterus, and here there is no prostate below the neck of the urinary bladder, and here there is uterus. So this justifies this as the female pelvis. Now structures from anterior to posterior. As you see, this is the symphysis pubis. Just behind that you can see this is the retropubic space of Ridgius, which contains vesicular, venous plexus and retropubic pad of fat, and this is the bladder. As you see here, so this is the apex of the bladder. This is the apex of the bladder. You can see the median umbilical ligament. This will be the superior surface. This will be the inferiolateral surface. This will be the superior surface. This will be the apex, and this will be the base or posterior surface of the bladder. This will be the neck of the bladder. And here this part is the trigone of the bladder. This part is the trigone of the bladder. As this is the male pelvis, just immediately next to the bladder will be the rectovesical pouch. Rectovesical pouch of peritoneum. Rectovesical pouch of peritoneum. From the lower part of the rectovesical pouch, there comes down a fascia called as Denon-Villiers fascia to the perineal body, separating the prostate from the rectal ampulla. So this is the rectum, and this is the most dilated part of the rectum, which is called as rectal ampulla. And this is the anal canal. This is the anal canal, and you can see here this is the anal canal, and this will be the pectinate line. This will be the pectinate line from which above goes the anal columns and anal bulbs and anal sinuses. This is the ampulla of the rectum, and here you can see this will be the presacral fascia, and this is the sacrum. This is the sacrum. So from anterior to posterior you can start. This will be the pubic symphysis. This will be the retropubic space of Ridgius, or you can say this is as pubic symphysis, or you can tell it as body of the pubis. Retropubic space of Ridgius, urinary bladder, prostate, Denon-Villiers fascia, rectum, then presacral fascia, then sacrum. And in female pelvis, as you see here, so this is the body of the pubis, retropubic space of Ridgius, urinary bladder, then between bladder and uterus, here it is vesico-uterine pouch, but here there is no uterus, it is only the bladder and rectum, so it is rectovesical pouch in case of male. So to repeat again, if in male, starting with body of the pubis, retropubic space of Ridgius, urinary bladder, prostate, rectovesical pouch, Denon-Villiers fascia, then rectum, then presacral fascia, then the sacrum. In females, body of the pubis, retropubic space of Ridgius containing vesicular venous plexus and retropubic pad of fat, then bladder, then vesico-uterine pouch, then uterus, and here you can see this is the recto-uterine pouch of Douglas. Recto-uterine pouch of Douglas, which is the prepared site to collect the ova for in vitro fertilization. And here you can see the rectum, and this is the most dilated part of the rectum, rectal ampulla, and this is the presacral fascia, and this is the sacrum. And most important thing, if I pull like this, see this is the uterus. So this is the uterus. So I have pulled it to the opposite side so that you can see this is the broad ligament of the uterus, and you can see here fallopian tube, and this will be the round ligament of the uterus, and this will be the fallopian tube. broad ligament of uterus, round ligament of uterus, fallopian tube. This will be the cervix, this will be the body, and this will be the fundus. On the uterus, normally it will be like this, anteverted and anteflexed. What is this anteversion? Anteversion, it is the angle between the long axis of the vagina and long axis of the cervix. It is around 90 degrees, and anteflexion is the angle between long axis of the cervix and long axis of the body of the uterus. It will be around 120 to 130 degrees. So normal position of uterus is anteversion and anteflexion. So time being, remember all the structures from anterior to posterior. In case of male pelvis, body of the pubis, retropubic space of retius, urinary bladder, prostate, denonucleus fascia, recto-vesical pouch, rectum, presacral fascia and sacrum. In female, body of the pubis, retropubic space of retius containing the retropubic pad of fat and vesicular venous plexus, urinary bladder, between bladder and uterus, uterovesical pouch, then uterus, between uterus and rectum, recto-uterine pouch of Douglas, then rectum, presacral fascia and then sacrum.